Doctor, my kid's coughing for weeks. What's really going on?
Chronic hypersensitive cough syndrome is often linked to infection, particularly viral respiratory infection, which can act as a trigger or contributing factor. Infection as a trigger. The upper respiratory tract infection. This infection can sensitize airway nerves, especially the vagus nerve, leading to prolonged dry cough. Post-infectious cough, the most common cough of chronic hypersensitive cough syndrome in children. This cough is often dry, worse at night, or with activities. Post-infectious cough, common after adenovirus, parainfluenza, or mycoplasma pneumonia infection. No antibiotics needed unless bacterial infection is proven. We can give a trial of Montelukast, antihistamine, proton pump inhibitor if reflux suspected. The cough often resolves between 6 to 8 weeks. Chronic hypersensitive cough syndrome in children often follows infections. Treat supportively, avoid unnecessary medication, and we monitor the progress.